to the meeting of the Executive Cabinet Member, Adults, Health and Wellbeing. I'm stepping in for Councillor Fieldings, who's the Executive Member, who's currently away on business. So in terms of the agenda, we've got 5 non-confidential items. Item 1 is monitoring of Cabinet member decisions, which is the document is enclosed. So if colleagues have any questions or queries, then please raise your hand now. Thank you.
I think it's pretty much up to date, that report. We've done well in working together to get that report up to date. So hopefully everyone should be in the picture.
Yeah. Okay, I see no hands, so I'll move on to the second item on the agenda, which is the Departmental Financial Monitoring final outturn 23-24 report. Who's taking?
I think that'll be Lisa, I think.
It
Lisa?
is indeed. Thank you very much, Chair. I'll talk through the, it is the adults one first on the agenda, isn't it, Sue?
It's yeah. Just like me. Yes, it is. Yeah.
Thank you. I just wanted to check. So the report in front of you shows the final outturn position for the adults portfolio. The Exec Cabinet Member is recommended to note the revenue budget position and the changes and the overspend of over £2 million before corporate support. Note any capital changes and delegate to the Director of Adults for anything on the framework for capital programme. If I take you through the summary, the revenue outturn position was 206,000 overspent at the end of the year, but we moved that into the final, into the reserve, at the end of the year. Capital programme was 521,000 and the reserves as at the 31st of March is £11.5 million. Going through the report, table 1 shows the changes in the budgets and the reasons why. Non-pool and pool budget has been paused again for another year and all strategic budgets have been achieved. In table 2, you can see the variances between the particular portfolios and then the capital programme. And I'm quite happy, Chair, to take any questions or comments.
Thank you. Thank you, Lisa. Any questions, queries from colleagues? Again, I do not see any raised hands, so therefore I note and approve the report. Thank you.
Thank you.
Thank you very much, Chair.
Moving on, item 3 is Department of Public Health Financial Monitoring Final Outturn 2023-24. Are you taking the report, Lisa, as well?
I am.
Yeah.
Thank you, Chair. So moving through, this is the final outturn position for public health. Cabinet members are asked to note the financial position and any revenue budget changes in the year. So revenue was an underspend at the end of the financial year of £250,000, which has moved into reserves at the end of the year. And the reserves are at a £5.2 million as at the 31st of March. Moving through, table 1 shows the budget adjustments that have happened within the portfolio. Members, please note that where it says ECM, Climate Change and Environmental Services, this is where Civil Contingencies portfolio sits. Moving down to the report, table 2 shows the unders and overspends with variance analysis for why this is, and table 3 shows the reserves. And Chair, I'm quite happy to take any questions and comments on this particular report.
Thank you, Lisa.
Thank you.
Any questions, queries from colleagues? No, there are no questions. So I note and approve the report. Thank you. Thank you, Lisa.
Thank you very much, Chair.
Moving on, item 4 on the agenda is Head of Service Mental Health report. So who's covering this, Sue?
I'm not sure. It might be Karen Kenyon.
Karen, yeah, Karen.
Hi, good afternoon, everyone. So this is to talk about establishing a full-time head of service post to support us with delivery of statutory duties, specifically within the mental health services. So just as a bit of background is that Council's mental health social work service is managed by Greater Manchester Mental Health Trust. So our staff are seconded into that under a Section 75 arrangement. However, we do have a dotted line responsibility back to the local authority to ensure that we are meeting statutory and legal requirements under the Care Act and a number of legislative and good practice guidance. Currently, we have one head of service post in place that's been there for a number of years. However, over a period of time, we've had a reduction in management cover from a local authority point of view in services, and that's putting us some challenge. But to support the partnership that we have with GMMH and to ensure that we're providing safe social work services, I'm requesting an additional head of service post, and that should ensure that we're complying with our legal requirements and casework, and to give staff within that service also line of sight to social work management cover as well. So the options would be to not establish the post, and that could put us at increased reduction in capacity to oversee complex casework and legal work. And then the other option is obviously to establish the post to enable us to have that oversight as required. The post will be funded from hospital discharge funds because a lot of the work is from hospital discharges via Royal Bolton Mental Health. And the grant does not include 25-26. It will be ongoing funding from the adult social care grant monies, which was received in 24-25. So from a finance point of view, it's we do have the money to resource the post. And that, Chair, is a snapshot of the post.
Thank you. Any questions, queries from colleagues? No, I do not see any raised hands, so therefore I approve the establishment of this post. Yeah, thank you.
Thank you.
Yeah. Right, last item 5 is children's placement and brokerage team business case.
Christian Marcandy.
Christian.
Thank you, Chair. Thank you all for having me here this afternoon. So this is regarding the children's placement and brokerage team business case. As I'm sure you will appreciate, it is projected that demand for children's placements, as well as the level of complexity for referrals, is going to increase. And to mitigate this business case seeks approval to build capacity and permanence within the team by establishing 2 further posts, a senior placements and brokerage officer and an administrator post. You'll appreciate this report has been drafted in consultation with our colleagues in legal, finance and HR. The purpose of these 2 posts is that this additional capacity will stabilise the team and is key to the ongoing success of our demand management work streams and supporting sufficiency and ensuring that Bolton meets its statutory duties. Funding for the additional posts will be funded from the 2024-25 increase to the social care grant. Children's Services received 1 million of this increase as agreed in the 2024-25 budget report. And in addition, of course, these arrangements will continue to support and contribute to Bolton's 2030 vision priorities. That's a very quick whistle stop tour of the report. Right. Any questions? Happy to take.
Yeah, thanks, Christian. Any questions or queries from colleagues? I see no questions or any raised hands, so therefore I approve the report. And thank you for your time, colleagues. And that concludes the business for this meeting. Thank you.
Thank you very much.
Thank you.
Bye.
Thank you.
Thank you.
Bye-bye.
Thank you. Goodbye.
Bye for now. See you soon.
Bye.
Bye.